I should say nice to meet you all here. It's always been a bit like, I don't know how to put it, but if you come to my clinic and I say, oh, nice to meet you, I think it's bad. So I'm so happy to say, nice to see you here and nice to meet you. And, being in the medical profession, you can't say, how good your business is. So, we have this annual sort of sacrifice to our ancestors. And a lot of times we'll be, praying for wealth, success, and there's something my mom is banned from doing. So you say, she can't pray for wealth for me. Good business. Good business means more people will be sick. So nice to meet up with you all here. Thank you. Yes, I'm actually made in China. Chinese made. Yes, thank you. We came here in 1981, and that is actually, same like everybody else who moved to another country to look for a better life for the children. And I can remember those days, how hard we had to struggle back in China. And those were the communist days. And we have survived through just eating rice with just soy sauce. But today, it's a lovely dish. Yes. So when we came to Fiji, we actually live in a small Chinese community. And in that community, all the kids, that are there, actually, all of them will grow up to be accountants, lawyers, or architects. So you can see the pressure that comes from there. Parents, my dad came and worked as a chef, but then, we had a good struggle in the early years where after end of the month, we don't usually have much left. So we're just thinking how, we're going to send this kid to school. After how he's going to be, we can afford, they usually said, go Australia, New Zealand to study. So even then, my mom had to work, at home to get extra income. Years later, my sister has to, sacrifice herself. She has to leave school to help out the family. So seeing all these things and what's around us, we had to really work hard to, make our parents proud. And I'm not lucky like Viraj's parents would say, don't worry, if you don't succeed in school, you still have something to do back home. For me, or for us, if you don't succeed in school, we can't send you to university because we don't have money. So you work hard, or, you're done. You come and work as a chef. So there is a lot of pressure those days. And it's not nice to be in that kind of environment. I wouldn't like my kids to be in that environment still today. But I guess, that actually made us work hard. And I remember waking up, it's crazy, our neighbors wake up at 5 o'clock in the morning and start learning their spellings. And we had to do that. But I don't see my kids do that nowadays. And I say, oh, you're lucky boys. Yeah. So the only profession then I can think of to make my dad proud is actually to become a doctor. And I for him, he actually was a doctor when we was back in China, but come here, he works as a chef. And he says, Zen, you want to be a doctor, you have to think again, Do you know how much sacrifice you have to do to become a doctor? You have to sacrifice your time, your personal time, your family time, and you have to be dedicated. And he say, if you gonna be a doctor, your role is like a mother to a child. That's what the doctor's role is. If you cannot, stick to that role or that phrase, I don't think you should be a doctor. But then, I didn't really take notice of that role. I just want to make him proud. Just, be a doctor. So, yeah, I in medical school, the only thing we can remember is just study hard and, get an award, bring it home, he'd be so proud and seeing his son walking upstairs to receive his award. And I did that, he made him proud. And then I never, enjoyed that phrase that he say, to serve, or the role of doctor is to look after your clients like your own family, or like a mother to her child. We're just, even in a hospital then, we just do just to survive or to get through. Not until that I was got thrown out to the outer islands. Anyone know where Matuku is? Yeah, in the Lao group, yes. It's almost to the last island of the Lao group. And I had to travel 2 days at sea to reach there and sleep on sandbags. It was just amazing journey. Yeah, that's where actually I learned, to love that phrase and love family medicine. Well, on that island there's a population about 850, and I really enjoy the place because we see about 10 patients a day, and by 10 we are done and out doing fishing. But then the best part is you actually looking after the client from the beginning to the end. Yeah, and you see that there is a very comprehensive care because you have time for them. You also see the continuity of the care, and that's what family practice is all about. Comprehensive means you have time for them, get to know the problem, diagnose the problem, and educate the patient about the sickness, and then following up this, the patient from the beginning to the end. So it's just, I fell in love with the family medicine then. So when I got back to Nadi, I worked, before joining private practice of family medicine, I worked at Nadi Hospital for about 4 months. And I tell you, you would not like to work there again, in a hospital setup. Wake up in the morning, start work at 8, you need to clear 80 patients in a day. 80 patients in a day, which basically you say about 5 minutes per patient. And if you're seeing a clinic, special outpatients, where you see asthmatics, hypertensives, diabetics, you are still doing the same, even sometimes going up to 100. Where's the time? Where's the quality time? And you don't get to see this patient again. So I would say if I put it back to work in a hospital, I would rather go and be a farmer. Yes. So when I joined private practice, that's how I actually had my mission. I would like to serve every client as my own family. When they walk into my room, walk into the office, whatever I should do, I would do what I would do to my parents, what do to my mom, do to my dad, how I'm going to do to my brother or sister. So that has been our mission since then. And that's what I would say, to serve. And to serve with compassion, and to serve with sincerity, to serve with openness. And I think this is those years that I started with, I found a lot of happiness. And I would prove you that, it's gonna be there. Whatever I got today, I don't think I have much, but whatever I have achieved today, it's just a side product of what I have been doing, which is to serve. So if I look back what we have done, after a few years of general practice, I got so busy that I don't even have, I don't even have time for my girlfriend. And I remember, my dad say, it's a personal sacrifice. You need to remember that. So there was one time when Carrie is my wife, by the way. She was my girlfriend then. We're supposed to go for a movie, and she, we just walk out of the gate, about to close the gate, and then the patient came in. And I couldn't say no to the patient because they already walked in, they traveled far to come and see me. So I say, okay, I'll see you before I go for the movie. And I tell you the truth. Carrie walked out, and she just walked away. So that's the family sacrifice that you do, this personal sacrifice that you have to do. Yeah. So as time when if you're going to treat your clients as your own family, those days I realize there's such a demand that after our service, in those days, even until now, is that if you end up in the hospital, government hospital, after hours, those days I remember there was only seen by nurses and then sent home. So a lot of our clients actually come back and say, look, we need something to back us up in Nadi. And we got all the doctors together, say, let's do something together. Let's start after our service. Let's do a bit of community service that we do. No one has very much interested to do this, so I took a chance. I said, okay, you guys don't do it, I'll do it. So I took a chance, hired 2 doctors. We started with the same mission, and I think with God's blessing, everything went well. Then we went on and tend to see more sick patients, more acute patients. And I tell you, stay with this in the room. It's when we see a patient, okay, we are trained to be a doctor. Okay, trained means we are trained to know the body. We are trained to recognize symptoms. Now, when the patient comes in to see us, we collect all the data. We're just like a policeman then. We collect all the information, examine the patient, collect all the information, and then we say, okay, we got about 5 lists of sicknesses that could actually present this way. Are you scared now? Yes. Now, what's our top priority? What's our second priority? So the truth is, we are not 100%, okay? And even today, I'm going to tell you the same. If you come to my clinic, I say, look, I think you have this, but I'm not 100%, but I got options for you. You can try this and see how you go. Or what you can do is do the diagnostic test and find out if you really actually have this, okay? So that's the truth, is that we as GPs or doctors, after consultation, most of the time, we have a list of differentials, and we actually guess the best one, okay? So then, to get diagnostic tests is like hell. When you get an X-ray, it's just, those days when we get X-ray, there's nothing digital, it's still analog. Until today, we still have analog in the hospital. So you get a film, and you're guessing again because you can't see what's happening. And then I say, we are doing this already. If I'm seeing this is my son, how would I make it better? How would I not miss anything, and I'll be sure I'm treating diseases? So we took another chance and invested in the digital X-ray. We brought in the first digital X-ray into Fiji, into the region. And then the digital ultrasound and the lab work. So we sort of able to do a diagnostic test and make a better impression of what the sickness is. And I'm proud to say, we're the first one to do this. We're the first one to run a 24-hour clinic to provide after our service. We'll also be the first one to have these facilities. I guess the biggest sort of gamble that I took was actually investing into a CT scan. Back then, that's about 2 years ago, I have 4 to 5 patients die because they can't access the CT scan service. and mainly the ones who needs a CT of the head or abdomen. You know what CT is, right? A CT scan is a scan similar to X-ray, but you take X-ray, you take only one slice or one film. But what CT can do is actually, they actually take slices of your body, and then you could actually see the different layers of your body and see what pathology or what sickness you have. Okay? So back then, we do not have that, service so accessible. If you have a patient who say, we're suspecting he could be having a hemorrhage in his brain. If you call up the surgical ward, you say, okay, just bring them tomorrow, or bring them after 2 days. We do a CT. And that's how, if I say, if this is my father who's coming in to see me, has got this, what would I do to save his life? Right then I'll do it. I'll find what's the problem, and I'll do that. I took a risk. I say, if I can save that 4 or 5 patients in a year, then, the bank can take it back. I don't have a problem. At least I've saved 5 lives, make 5 families happy, So with God's blessing again, this is the 3rd year going, and we're still doing okay. Yes. And the other area that we had was in terms of community service, which is the dialysis center. And I had patients back then who actually have to travel 3 hours to Suva and 3 hours back, and who is sick with kidney problem. And we just feel so passionate. I was so, how do you say? I think I'm a bad businessman, actually. That's what my brother always tells me, who's actually managing the clinic now. He say, "You're a bad businessman. You're bloody lucky only." Yes. So I'm not a businessman. Actually, I just seeing there's a need for service, and I went for it. So, but I think if you do it and find your purpose, if you serve or give away, you will find true happiness. And that's the biggest reward you can have already. And I can share with you this happiness is just like a ball of energy, You can, I don't know how to describe it. I think that you need to experience it. And I'm sure a lot of you would have experienced it already. It's like a ball of energy. It's right here. And every time you actually serve somebody with thinking that this person is actually your own family, or someone who you know, or good friend, something that, someone you treasure, that reward comes immediately to you because you have served them, with the same way you serve your family. And that ball gets bigger and bigger every day, You don't even have to think about the stress at work, stress at your life, because these, this kind of energy that you have, that you're building, just absorbs all this stress that you go through. Yeah. I was asked actually, what is my vision for the future? I actually want, to see that happen before I retire. And I think it would be good for all of us who are actually wanting to stay back in Fiji and enjoy, And we don't have to go out when we get older because we don't have what the neighbors would have, which is the specialist services. So my vision I'm working on is I would like to see that our brothers and sisters, our moms and dads, do not need to travel afar to get a hip replacement. Okay? To do a simple surgery that needs laparoscopic. And with that, we want to have that accessible to us and at a much reasonable cost than what our neighbors can get. So that's my vision. And this is not just for Fiji. We would like to look into the whole region. And a lot of our skilled doctors actually has migrated because, number one, they do not see what we see, probably some of us will see, or if not, they have the working condition, like I say, working in a hospital. So if we can actually provide a center where they could be retained and be trained by local, overseas experts, that is my vision, to have them stay back in the Pacific and service the Pacific. So that's my vision. And you may ask me again, I want to tell you again, what have I learned so far? Well, still I'm a bad businessman, okay? But I can tell you, if you serve and give away and give it from here, thinking, this is my sister, this is my brother, this is mom, this is my dad, this is how I'm gonna give it, okay? It may not be a big way, okay? It may not be a big way, but if you're able to give, you will really find true happiness. And, the side products or the byproducts will come eventually, and like Viraj said, it will just come. Now, it can be a very small way, and you can start from home. Simple as starting from home. Like Viraj just did. Thank your mother for bringing you up. I think that's the biggest gift. You didn't cost you any money, but a bit of ego that you may have to lose. Yeah. Thank your wife for making a wonderful dish. And that's something that it didn't cost you much, but it will bring you so much happiness and love in the family. When you're out in the street, if you find something, if you pick up somebody's lost phone, don't just smile, give it back, I think you really find that energy that's going to build, and the ball of energy that you're going to build will grow and grow every day as you give. Okay? Same with at workplace. Thank your worker for coming early. Have you ever thanked them for coming early? Or thank them for being nice to their client. Or just being a worker, if someone comes into your shop, serve them like you serve your own family. Don't say, oh, we don't have this product. Don't waste my time. I'm sure this client, this client would never come back to your shop again because, compared to someone say, oh, yeah, we don't have this product, but you may want to try the next door. He actually have something, that you may want, Now you actually serve because you feel that, if I can help this guy, if I can treat him like my own family, this is what I would do for him. And I'm sure this guy would say, oh, he's been so nice. If I need something, I'll come back to this shop again. So my message here is give, and give with compassion, give with sincerity, and give it with openness. Thank you.